everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Agomelatine. Its brand name is Thymanax. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Agomelatine is an antidepressant that has melatonergic agonist and serotonergic antagonist activities. It increases norepinephrine and dopamine release in the frontal cortex with no influence on extracellular levels of serotonin. In terms of indications for use, Agomelatine is indicated to be used in the treatment of major depressive disorder, or MDD. So before somebody was to use Agomelatine, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. It would be contraindicated in patients who are using potent CYP1A2 inhibitors. It would be contraindicated in patients who have hepatic impairment or have transaminases elevated more than 3 times the upper limit of normal. And finally, it would be contraindicated in patients who do have a hypersensitivity to Agomelatine or any other component of the product. Now, in terms of precautions, patients should be made aware that alcohol use should be avoided. Use is not recommended in patients who have a galactose intolerance or in patients who have glucose-galactose malabsorption. And this would be because the product does contain lactose. Life-threatening and fatal liver injury, liver enzyme elevations greater than 10 times the upper limit of normal, hepatitis, and jaundice have all been reported with the use of Agomelatine. Drug discontinuation would be warranted if any of this was to occur. Before we would actually allow a patient to try this medication, the physician would have to weigh the risks and benefits in terms of their liver injury risk. So they would look for things like obesity, non-alcoholic fatty liver, diabetes, or alcohol use. There is a risk of a substantial increase in drug exposure in patients who use Agomelatine that do have liver impairment. Patients need to be made aware that worsening of depression, as well as the development of suicidal thoughts or ideation, is a possibility with this medication. Physicians would monitor patients for the worsening of depression throughout the course of therapy, and especially during dose changes, whether that's an increase or a decrease in dose. It must be used cautiously in patients who have bipolar disorder, as the use of Agomelatine may put them at an increased risk of experiencing mania. It must be used cautiously in patients who have moderate to severe renal impairment, and it's not recommended to be used in patients who have dementia or in patients who are greater than 75 years of age. And finally, Agomelatine is not recommended to be used as a depression therapy in patients who are less than 18 years old. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Agomelatine, they can expect to receive their dose in tablet form. So when patients are using this medication to treat their major depressive disorder, they would use 25 milligrams once daily at bedtime. If there's no response after 2 weeks, the dose would be increased to 50 milligrams, and the patient would try that dose for at least 6 months. The medication can be taken with or without food, and upon discontinuation of the medication, no taper is necessary. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Agomelatine, so I'll go over some of those here now. Hyperhidrosis, or profuse sweating, can happen in 1% of patients. Abdominal pain and constipation happen somewhere between 1 and 10% of the time. Diarrhea, nausea, and vomiting fall in that same range of 1 to 10%. Some patients may feel an ache in their back when they use this medication, and dizziness as well as insomnia are also possibilities. Now, some more rare but serious side effects would be hepatitis, jaundice, liver failure, or hallucinations. That's all we're going to talk about today with Agomelatine or Thymanax. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.